I'm the new administrator of the US Digital Service, which is you might know us from the group of geeks that helped rescue the healthcare.gov website. And our goal is pretty simple. We try to make sure that the federal government delivers the best possible services to the public that we can. We actually celebrated our 3rd birthday recently. We're still around, we're still working on projects that matter, and we're hiring. I wanted to talk to you today about one project that's going really well and that has a lot of impact. It's about trying to make the Medicare system more efficient. Now, if you had come to me a year ago, I would have been like, oh, Medicare? Really? What is that? It turns out Medicare affects 55 million Americans. It pays out over $650 billion a year, which is 3.5% of the US economy. And most of the healthcare industry looks at what Medicare does and often mimics it. So add another $2.5 trillion on, you're talking 18% of the US economy. Now that's just a bunch of numbers. So let me give you one more reason why we need Medicare to work well. This is my dad. I got permission to put his picture up. He just celebrated his 75th birthday last month, but he almost didn't. He exercises every day, but over the July 4th weekend, he had a serious health issue. This is my dad's heart. It turns out he had an 80 to 90% blockage in his left main artery, which I discovered is also called the widowmaker. Now, he's okay. He had heart bypass surgery. He's looking forward to getting back to playing tennis again this week. He had really good coverage at his local hospital in Kentucky, care that was effective and efficient, but not excessive. So getting Medicare right really matters. I hope none of us have to deal with the healthcare system, but probably all of us will, if we're lucky. So the goal is to figure out how we can make Medicare better. Unfortunately, right now, Medicare doesn't really pay for encouraging better results. The more tests you run, the more you get paid. And the more expensive technology you use, the more you get paid. Even if that doesn't really encourage better outcomes for patients. So Congress saw this, and in 2015, they passed a bipartisan law. The idea was simply to pay for patient care, not just for quantity. So they told CMS, which is the agency that administers Medicare, to do 2 things. 1, collect data on what doctors were doing. And 2, adjust the payments based on the quality of the care. Now, what's an example of that? Very simple one. If you get treated in a hospital, do you get readmitted to the hospital within 30 days? By the way, Congress said to start doing this within 2 years. Now, if you have ever built a large system that affects things at a national level, you know that's not that much time.